Please welcome my next guest, Melissa Cobb. Thanks for being with us, Melissa.
You bet, yeah.
Can you tell us a little bit about your role as a nurse practitioner in the oncology department at St. Peter's?
Sure, yeah. So I work with a team of specialists and professionals at St. Peter's Hospital that includes an oncologist and oncology RNs, and we collectively manage patients with cancer. In my role specifically, do mostly symptom management, so symptoms of cancer and of treatment. That includes things like pain or nausea, vomiting, obstruction, and those kinds of things.
Great. We hear a lot of people talk about cancer, but can you tell us really what is cancer?
Sure. So cancer is basically changes in the DNA of a cell that sort of makes the cell not function like it normally would, not like a healthy cell, and then also takes away the regulation of replication, so allows the cell to grow out of control and sort of invade other tissues and distant organs, and it's sort of non-functioning and out of control.
So how do you find or diagnose cancer?
So cancer is found in a number of ways. Sometimes it's found on screening. Sometimes patients present with symptoms. Typically, or oftentimes, it's found on imaging studies, such as like a mammogram. An example of a screening would be like a colonoscopy or a PAP. Okay. And patients then go on to probably more diagnostic studies like CT scans, ultrasounds, those kinds of things, but ultimate diagnosis is based on tissue biopsy that's sent to a pathologist and looked at in a lab.
Okay, so once the cancer has been diagnosed, what happens next for a patient?
Usually the ordering provider receives the tissue pathology, and then appropriate professionals are contacted for consultation, such as an oncologist or a surgeon, and then they would sort of meet as a team with a patient.
Okay, so once you've met with the specialist, do they decide then how the cancer is treated? What's the next step after that? So
treatment is based on staging and type, and there's three main modalities of cancer treatment. Generally, there's either local therapy, such as surgery or radiation, and then systemic therapy that includes like immune therapy, biotherapy, hormone therapy, traditional chemotherapy. And here in Helena particularly, and all over the country, it's based on national guidelines. That's the standard of care. And so your physician and your team will work with you on making those options available.
Okay. You brought up immunotherapy, and we hear a lot about targeted and immunotherapy. Can you tell us the difference between those two different types of therapy? So
immunotherapy basically helps your body's own immune system to fight the cancer. It sort of beefs it up a little bit. Mm-hmm. And targeted therapy works on specifically targeting different modulators on the outside of tumor cells. So instead of having a more systemic infusion or something like that with chemo, mm-hmm. a targeted therapy goes right to, or tries to go right to the cancer cells.
With so many different types of treatment out there, how do you decide really what is the best way to treat a person's cancer?
So again, it's based on national guidelines. When a patient receives a diagnosis and they're staging, we look on NCCN national guidelines and sort of go based on that and try to work with the patient what their goals are and develop those realistic goals for them, whether it's curative or palliative. And really the patient is involved in the whole process.
Okay, so they get to have some say
Absolutely.
in the treatment.
Absolutely.
So the NCCA guidelines, is that what you said?
NCCN. Yeah.
NCCN. So would that mean that a person that was treated in Montana would be under the same guidelines as somebody in New York?
Right, that's the standard of care, yes.
Okay, so we can feel rest assured that patients in Montana are getting great care for their treatment.
Absolutely.
Awesome. So another question a lot of people have is, can cancer be prevented?
So when I think of cancer prevention, I think of screening and vaccination, and I also think of risk reduction. So risk reduction includes things that are like associated with cancer. We talk about obesity, so physical activity and a healthy diet are ways of reducing your risk of cancer. We talk about decreasing your tobacco use or eliminating tobacco use because that's a carcinogen, limiting alcohol use, and avoiding UVA and UVB rays, the sunlight or tanning beds, things like that. As far as prevention goes, you can work with your primary care provider to figure out appropriate screenings that are good for like a person's age group and their other risk factors. And then there's vaccination against viruses that are oncogenic.
Oh, awesome. So you seem to have a very wonderful passion about cancer treatment. I'm just curious to know, how did you get involved in oncology nursing and actually as a nurse practitioner?
When I graduated from Carroll, my first job was at St. Peter's Hospital. I started out in pediatrics, and the floor was combined, pediatrics, oncology, and surgery. And I just sort of fell into oncology. And when I met with the patients and the providers, the great people that we have there, it sort of felt like a good fit for me. So I worked in oncology as an RN for 10 years there, and then went back to school for my master's degree 2 years ago.
And then just came back to be a nurse practitioner right where you left off.
Right.
Oh, that's awesome. Well, I'd like to thank you, Melissa, for sharing all sorts of great information with us on cancer. Up next, we'll meet someone who helps patients with their caregivers navigate the healthcare system from diagnosis through treatment. Stay with us.